Ouch. Noisy. Okay, this is somebody want to mute their mic there? Is that MJ? Is that you? Okay. This is Advanced Professional Practice, Unit 4, Part 1. And a couple of presentations. We'll talk about advocacy, and then we'll talk about collaboration next. Someone's got an open mic and it's really noisy in the background. If you don't mind muting your mic, that would be appreciated. So, we've acted as advocates for patients for many years in EMS, oftentimes unofficially, and more recently a little bit more efficiently with things like CREMS. And I intentionally left out CREMS because you're all familiar with community referral EMS systems, and some of you have your own community paramedic programs in your area, and so there's some variation from service to service, so I left that out. But some of the other services that you might consider or think about when you're encountering patients are listed here, one of them being victim services. So they go by different names in different regions, but the victim crisis assistance and referral system is what we have here in this region here, and it's a community-based system of volunteers that assist police and EMS, and a mix of paid and volunteered, and they're there to provide some short-term emotional support and practical assistance to victims of crime in certain circumstances. In Toronto, you probably have something a little bit different. Chris or MJ, do you know what kind of system you've got there? Deals with this sort of thing? I see Chris is typing in the meantime. I'll just keep going. So these are largely made up of community volunteers, and even for crisis situations, you go through your community paramedics, Chris? Or do you go through police? Okay, yeah, fair enough. Yeah, most services do this sort of through police, but occasionally we bypass police if they're not involved in the call. So they provide victims with immediate needs and refer them to other community services if long care assistance is required. And they're available 24/7 in this area, and these are the numbers. They're in your handout anyway. So some examples of the services that Vickers provides includes services for abuse, accidents, accommodation crisis, so people who don't have a place to live, assaults, arson, break-and enters, robbery, home invasions, vandalism, that sort of thing. And they also provide some court support, and so we'll accompany people to court sometimes and give them an overview of the whole court process. They also do critical incident stress. They also help with death notifications and involving, whether fatalities, disasters, domestic violence, drowning, and grief bereavement. We have a couple of different teams. Neither of them are called Vickers in our region, but they do similar things. So they also deal with family crisis, fraud, fire, things like harassment, homelessness, homicides, and mischief, missing persons, motor vehicle collisions, excuse me, personal injury, personal crisis, just to list them off. Road rage. I don't imagine they get many of those, but who knows. Sexual assaults, stalkings, substance abuse, and so on and so forth. So the North Simcoe Victim Services, what they do with the consent of the victim is either the attending officer or the paramedic will call volunteers to render whatever emotional support is practical or is needed. And I know some paramedics in this region, in the Simcoe region, have used their services, have called directly, and they may assist family or friends as well. And they may also provide transportation to places like emergency shelters or make phone calls and other arrangements or requests, you know, sometimes to family members to get them involved for support when someone's distraught. And then for longer term needs, what they do is they refer people on to other services, essentially. Children's Aid Society, just out of curiosity, have any of you had to call Children's Aid over a suspected child abuse? Twice, eh? I haven't had to, although I can think of one incident where I should have and didn't, because at that time it was my perception that if police were taking care of it, I didn't need to. What I learned, though, is that even if your certain police or nursing staff are going to call, CAS wants you to call as well, because they want information from different parties, so they have different perspectives on the matter. So a little bit about CAS's role. So they're a not-for-profit organization working in local communities, and their primary goal is to provide help and support for families and their children, not to separate parents from their children, although that's the common perception, is that they're there to separate family from the children. So they work under the authority of the Child and Family Services Act, and they're operated by a board of directors that are a group of locally elected officials from the community, and they have a specific interest in the welfare of the children. So their services are developed in response to local needs. And their role primarily is to investigate allegations of abuse and or neglect. And as I said, you and I have a legal obligation to contact Children's Services if we believe there's been an instance of abuse or neglect, even if police are on scene and we know they're likely going to do the same thing, or we take a patient to the hospital and we know nursing staff are likely to do the same thing. We are also legally obligated still to make that contact. And their other role is to protect children when necessary. Also to provide guidance to family, counseling. So their objective is primarily to keep families together, not to separate them. So to provide counseling intended to protect the children and to prevent further circumstances of abuse from happening. And are we obligated to call CAS while off duty? That's a good question. I don't think we're legally obligated while off duty, but I think you could argue morally that that's something we probably should do if we suspect it. Actually, I'm gonna pause the recording for a split second here. Okay, so
considering what happened in Alberta there a couple years ago, it's probably warranted, I guess.
Yeah, well, and I think the kid in Alberta had meningitis, right?
I believe so, yeah, but they tried to treat him homeopathically, and
yeah, I think if I saw something like that, anything more serious than a cold that was being treated homeopathically, I would definitely consider calling CAS. Yeah, I think as Chris pointed out, it would depend on the illness. Yeah, and I don't think this is a case of Munchausen syndrome, but yeah, it's disturbing anyway. So sometimes they'll place, in cases where they separate kids from family, they'll place them up for adoption or place them in foster care. I think the first step is foster care, and then adoption if the parents are killed. I think adoption is the last option. So Just some stats out of interest. There are 47 children's aid societies in Ontario. I think your handout says 53. There's 47 currently right now, and there are over 80,000 investigations per year, which is up from your slides, which I think it says 40 to 60 or something. And so, question: who calls CAS? That can be professionals or citizens. To answer your question, Terry, can call CAS when they suspect abuse or neglect. I don't think as a bystander you're legally obligated to, but the people who call CS most often are law enforcement officers and teachers. My wife is a teacher, and she sees some terrible things in her classroom and has had to call CS a number of times over the years. It's a terrible thing, when you see kids on a daily basis who are victims of abuse. And families can also call CAS for themselves if they're having difficulty managing their children, or they're, having issues where they are worried that they're going to abuse their kids. And children can call CAS as well if they're encountering problems at home. I don't know how often that actually happens. So when to call? The time to call is as soon as you suspect abuse or neglect. And from what I learned from someone from CAS who came to one of our CMEs, she said basically, even if you just a gut feeling tells you there's something going on, just call and they will tell you if it's something that they will investigate further or not. So there's no penalty per se for calling when it may not be 100% justified. And they're available 24/7. And but a call to CS will bring immediate help to a child at risk of abuse. And it's not our responsibility to determine whether there actually is abuse or neglect that has occurred. CAS does that investigation, makes that determination. So they open up his file on these kids. They look at not just one report from a paramedic, but they look at reports from bystanders, from teachers, from police officers, and if they've got corroborative reports, then they investigate a little bit deeper. CCAC, you're all familiar with CCAC. The CCAC and the LINs have merged recently, and I've heard rumor that the LINs might be disintegrated. I don't know if that's going to happen or not. I don't know what the future holds for CCAC or not, but we'll see. So CCAC works with a multidisciplinary team, including physicians and various hospital teams and various providers, and now with community paramedics to improve access and coordination for people in need of healthcare in the community, to help keep people at home, to help them live independently, and to apply on behalf of clients for long-term care. I'm not sure what the waiting list is for long-term care these days. Probably depends on whether you're living in Toronto or out in the suburbs. Depends on probably varies from one community to the next. And they're a branch of the Ministry of Health and Long-Term Care, and not sure what that 14 is for there, but it's probably just an error in the bullet point. Oh, sorry, there are 14, I guess, CCACs in the province. So there are community home-based services such as healthcare provided in home, personal support workers, case managements, and care on a periodic or ongoing basis as needed. I've seen people with care literally 7 days a week, and some people with care 3 days a week, depending on their physical needs. And the objective, obviously, is to reduce the need for institutionalizing these patients, because we know that institutionalization can be very expensive. Just to give you an example, I don't know if I told you about the Deep River community paramedic example, but Chief Mike Nolan decided he wanted to establish a community paramedic program in Deep River, and there were 32 elderly clients who were all I guess, eligible for long-term care but wanted to continue to live independently. So he sought and received funding to establish a community paramedic program. He had one community paramedic, primary care paramedic, and his on a regular basis and determined needs. And he coordinated a multidisciplinary team. So he would go and see these clients, and if they needed wound care because they were post-op, he would contact a nurse. If they needed PSW, he would do that, or they needed Meals on Wheels or physiotherapy or occupational therapy, he would make those contacts and arrange for those people to come in. He was also giving flu shots and immunizations and things like that, and doing some assessments. And what they found was the cost of that one community paramedic and the entire multidisciplinary team cost an average of $15,000 per year per client. Compare that to, someone's still got an open mic, it's really noisy. Compare that to the cost of long-term care, which is about $65,000 per client per year. So 15 versus 65,000, that's really significant. Take a small community of 30 where there's 32 clients like Deep River and expand that out to the province, and we could be saving in the tens of millions of dollars annually if we expanded our community paramedic programs. So I think, you know, that's part of the benefit of community paramedic program and organizations like CCAC, and I think the advantage of community paramedic programs is that we see clients who are at risk that CCA would never have heard about. So as you know, you go to 911 calls, you see elderly couples living together who have no support whatsoever, and we can identify those and refer them on to community paramedic programs.
Rob.
Yeah.
On that topic, I wondered, have you been following what's been going on in Niagara in terms of trying to make paramedics more of a sort of expand that into less of a strictly emergency response capability and really making it not just a separate program, but really making medics a sort of health integration system. It sounded fascinating. I didn't get the exact details, but it sounded really like they're trying to move in that direction on a system-wide basis.
Yeah, I heard a little bit about that. That's an interesting concept, rather than having specific community paramedics, just having the role for all paramedics change or be modified a little bit. It's an interesting concept. I don't know much about it either, but it sounds like a system worth keeping an eye out on. Yeah. All right. So CCAC is actually used by people of all ages and with various disabilities, physical illnesses, or people who are aging and are recovering from an event like a surgery or a crash or something, some injuries, to provide them with some assistance. So who can call CCAC? Any individual requiring service, any family member, any caregiver or friend, physician, other healthcare provider, and that includes paramedics, even though we are not technically considered professionals. Okay, let's talk a little bit about sexual assault and rape crisis centers. You'll find a rape crisis center in virtually every suburban, urban center in the province, and this is the central website for the different locations around the province. And they provide individual and group support, crisis intervention. They accompany police and clients to court. They are an advocacy group, and they also provide public education and information sessions and resources. And these groups will come to, you know, your conferences or your service and provide CME just like CAS and the other agencies. Addiction services, so RVH, for example, has an addiction service here, and this is what they call a non-medical withdrawal management service. clients requiring rehab from addiction or chemical dependency, and services available to anyone who's at least 16 years of age who's intoxicated or withdraw or in crisis. And they assist clients in their withdrawal from various chemicals, benzos, inhalants, narcotics, hallucinogens, etc. And that's just some web links to different services. And sort of the end of the slide presentation came up a little quicker than I anticipated. Anything you guys wanted to add, or?